Medical imaging, it's really the invisible engine of modern medicine, isn't it? Every day, millions of scans, X-rays, CTs, MRIs are being created. It's this massive, flowing river of data that holds the keys to our health. But how do you manage that river without it turning into total chaos? Okay, let's dive into this.
Really think about that for a second. We're talking about millions of images, and every single one of those files is tied to a person, to a family, to a critical decision that needs to be made. This isn't just a tech problem about storage. It's one of the most complex logistical puzzles in all of healthcare.
And the stakes? They couldn't be higher. If you're too slow getting an image to the right doctor, treatment gets delayed. If there's an error, the consequences can be devastating. All of this piles an immense amount of pressure on the clinical staff, on the hospital's budget, on the entire system. It is a constant, high-wire balancing act.
So how do you solve a puzzle like that? Well, today we're going to dig into one answer that's been evolving for the better part of a decade. A platform called Freedom Nano, which was designed from the ground up to try and tame all that complexity.
Now, this thing didn't just appear overnight. It actually started way back in 2014, and it was built for the specific needs of small clinics. But it grew, and today it's a full-blown enterprise solution that powers some of the biggest and busiest healthcare networks in the world. That journey from a small clinic to a global platform is so important because it proves the system can adapt.
So what's the secret sauce here? What's under the hood? It's something called a distributed cloud architecture. Now, I know that sounds super technical, but the idea behind it is actually pretty simple. Forget about old-school servers in a closet that are always filling up. Instead, picture this, a smart library that just keeps expanding whenever you need it to, and it organizes itself. That's the core concept. It's a foundation that's built for basically limitless growth.
But hey, powerful technology is one thing. Does it actually work in the real world when things get chaotic on a Tuesday afternoon? So let's walk through what a typical day might look like, starting from the moment a patient even picks up the phone. The entire journey for a patient and their images is mapped out here, designed to be this smooth, unbroken chain of information. It flows logically from scheduling the appointment to intelligently routing the images to the exact right specialist, then letting them view and analyze the scans, and finally creating and sharing that all-important report. And that very first step has a really key detail that simplifies things for the patient. You know how frustrating it can be trying to navigate some clunky online portal? Well, this system empowers the staff to just handle scheduling right over the phone. That information then flows seamlessly right into the registration system, which means fewer errors and less headache for everyone.
And that idea of flexibility, it's baked into everything. This is not a one-size-fits-all deal. Radiologists can use the viewing software they already know and prefer. Reports can be generated in familiar tools like Microsoft Word. It's built to handle absolutely massive files from PET and MDCT scanners without breaking a sweat. It even helps cut down on waste with digital film options. You see, it's all about fitting the technology to the hospital's workflow, not the other way around.
Now, an efficient workflow is fantastic, but in medicine, speed without accuracy is frankly dangerous. So the most crucial question is, how do you ensure the absolute highest quality of care? How do you build diagnostic confidence? Well, that's where peer review becomes absolutely essential. And Freedom Nano integrates a really sophisticated peer review module. We're not talking about a casual, hey, can you take a look at this? This is a formal process. Cases get selected at random and are assigned anonymously to another radiologist. They then use a structured rubric, a checklist basically, to evaluate everything from image quality to the clinical impact. It's objective, it's evidence-based, and it's designed to remove bias and create a genuine opportunity to learn.
And the impact of doing it this way is just a total transformation. You move from feedback that might be unstructured or even biased to a system that's objective and driven by data. Learning becomes a collaborative, ongoing process. And, critically for hospitals, this provides the crystal-clear documentation needed to meet tough accreditation standards from bodies like JCI, the Joint Commission International, and NABH. So, the system streamlines the present and it ensures quality. But what about what's next? What about the future? Well, the next massive shift in radiology is already here, and its name is artificial intelligence.
AI isn't science fiction anymore. It is being used right now as a powerful assistant for radiologists, helping them spot subtle fractures, analyze emergency brain scans, and detect signs of cancer earlier than ever before. But here's the catch. Different AI companies specialize in different things, which creates this powerful but really fragmented landscape of tools. And that fragmentation is a huge headache. The old way means hospitals have to juggle dozens of different AI systems from different vendors. It's a logistical nightmare. The Freedom Nano approach is completely different. It acts as a unified platform, a single hub where a hospital can plug in and access all sorts of AI tools seamlessly. It just simplifies the whole process of adopting this cutting-edge tech.
So, we've covered the workflow, the quality control, and the future-proofing. Let's pull it all together. What is the real-world impact when you reimagine an imaging workflow from the ground up? What does it all mean?
It really boils down to these 4 pillars. When you get the fundamental flow of information right, the positive effects just ripple outwards, and they touch every single part of the patient care journey.
First off, it enhances productivity. A smoother workflow just means less wasted time, faster report turnaround, and a more efficient department all around. Pretty straightforward.
Second, and this is so important, it reduces staff stress. When clinicians have tools that actually work with them, not against them, they can focus on what they were trained to do, practice medicine. This is a direct answer to the burnout crisis we hear so much about.
And all of this culminates in the most important impact of all. The patient's experience is smoother and less stressful. And ultimately, the clinical outcomes improve. A faster, more accurate diagnosis, supported by quality checks and integrated AI, directly contributes to better, safer patient care. And that is the ultimate goal.
So as we wrap up this explainer, it really leaves us with one final thought. In a world where medical data is growing exponentially and technology is advancing faster than ever, the crucial question every healthcare provider has to ask is this: is our imaging workflow simply getting us through today, or is it truly built for the future of care?